Welcome to your physical activity program, a guide for you and your family while recovering from cardiac surgery. My name is Audrée Brooks, and I am a physiotherapist at the University of Ottawa Heart Institute. I will be the moderator for today's session. I want to start by thanking everyone for taking the time to attend today's webinar on physical activity after recovering from cardiac surgery. Please refer to pages 35 to 43 in your Recovering from Cardiac Surgery booklet. Your physiotherapist has developed a physical activity program of morning exercises and daily walking for you to complete during your first few weeks following surgery. The program has been designed to help your recovery, build your endurance, and prepare you for cardiac rehabilitation. This physical activity program will be modified and progressed when you start cardiac rehabilitation, according to your abilities and personal goals. Regular physical activity will help you to lower blood pressure, improve endurance, fitness, and energy level, improve blood cholesterol, manage weight, and manage stress. Expect to feel tired for the next few weeks, gradually increase your activity level, and need frequent rest periods. Abnormal responses to exercise may include nausea, headache, dizziness, chest pain, or palpitations. If you notice any of these symptoms, stop and rest until these symptoms decrease. If these symptoms persist, it is an emergency. Call 911 or go to your nearest emergency room. For any other concerns, call the nursing coordinator at the 24-hour access number 613-696-7000. Press 0 and ask for the nursing coordinator. Here are some physical activity tips. Breathe steadily and in a relaxed manner while you exercise. Avoid straining and never hold your breath. Make sure you walk at a pace that allows you to maintain light conversation during the activity. Walk on flat ground to start. If hills are unavoidable, walk more slowly when going uphill. It is best to wait up to an hour after a meal before you exercise. This is because extra energy is required for digestion. Avoid exercising in extreme temperatures. During the summer, if it is very hot and humid, walk during the cooler part of the day, such as in the morning and later at night, or exercise indoors. During the winter, if it is cold, windy, or icy, it may be safer to exercise indoors. If you choose to exercise outdoors in colder weather, walk during warmer times of the day and cover your face with a scarf to help warm the air before it reaches your lungs. It is important that you keep a good posture. Try to keep your shoulders back and relaxed. Avoid slouching forward. Do not cross your legs, as this slows down circulation and will increase the risk of developing blood clots. Your physical activity program has two parts: a morning exercise routine and a daily walking program. The day you return home from the hospital, you should rest. The next day, do your exercises in the morning and then start your walking program. Sit straight on a chair with your feet flat on the floor, back supported, and shoulders down. Take as deep a breath as you can through your nose, then breathe out of your mouth. Maintain good posture. Repeat 5 times. You can try to cough after this exercise to help clear your lungs. Make sure you hold your chest when you cough to protect your incision. Sit straight on a chair with your feet flat on the floor, back supported, and shoulders down. Breathe in as you lift your arm up forward as high as it'll go. Breathe out while lowering your arm down. Repeat 5 times. Do the same exercise with the other arm. Sit straight on a chair with your feet flat on the floor, back supported and shoulders down. Lift both shoulders up as high as you can. Let them relax down. Repeat 3 times. This exercise is to help your posture. Sit straight on a chair with your feet flat on the floor, back supported and shoulders down. Squeeze your shoulder blades together. This exercise should not cause sharp pain. Repeat 3 times. Sit straight on a chair with your feet flat on the floor, back supported and shoulders down. Keep your head facing forward. Bring your ear towards your shoulder until you feel a stretch on the opposite side. Hold 3 seconds. Repeat on the other side. Repeat 3 times. Sitting on a chair, hands resting on your lap or crossed on your chest. Gently rotate your trunk to one side and hold for 3 seconds. Repeat to the other side. Repeat 3 times. Sit with your back straight and hands on your lap or at your side. Straighten one knee, pulling your toes towards you. You will feel pulling in your calf and the muscle in your thigh will tighten. Move your ankle back and forth 10 times, then lower your leg slowly. Repeat 3 times with each leg. Holding a solid surface, place your feet shoulder width apart and keep your back straight. Bend your knees and hips slightly, keeping your heels on the ground. Squat slightly as though you were sitting on a chair. Return to a standing position. Repeat 10 times. For your daily walking program, please refer to the booklet, Recovering from Cardiac Surgery. On page 39, you will find details of your prescribed individualized program. You will be walking twice a day. Make sure you walk at a comfortable pace that allows you to have a light conversation without becoming too short of breath. Refer to your booklet for the progression of your walking program. You will continue this program until you begin cardiac rehabilitation. After your walks, stretch your calf muscles. They are likely to get tight as you begin to increase your daily activity. Stand straight, close to a solid surface on which you can use your hands for balance. Place one leg behind the other with both your feet pointing forward. Bend the knee that is forward while keeping the back knee straight until you feel a stretch in the back of your calf. Hold for 30 to 60 seconds. Repeat with the other leg. Repeat 2 to 3 times. Cardiac rehabilitation is a program of exercise, education, and counseling that will help you to make healthy heart living part of your everyday life. More information can be found on the Heart Institute website in the section for patients and family. For any questions about cardiac rehabilitation, please call 613-696-7068. Keep track of your activity and progress in the activity log found on page 40 to 43. It will help both you and your healthcare team to see how much you have improved. If you have sternal precautions, make sure to continue following them once you return home. This means no pushing, no pulling, no lifting more than 5 to 10 pounds for 6 to 8 weeks from the date of your surgery.